All right, welcome back, viewers. This is Devin with Oriana. We have another special guest today. So Megan, go ahead and introduce yourself.
Hi, everyone. My name is Meghan Sarna. I am a family nurse practitioner here at Table Health. I'm also a cardiac nurse at Munson. And I am a certified holistic nurse with the American Holistic Nurses Association. So that's who I am, and thanks for having me.
Of course, I'm glad to have you today. It'll be an awesome perspective to share on our little vlog series. So what are you gonna, speaking of sharing, what are you gonna share with our audience today?
Well, we kind of previously discussed this, but being at home, isolated, it's a perfect time to work on your own personal self and self-care. So I think just discussing different categories related to self-care, self-check-in. So there's a lot of dodgy health advice out there right now. So it's kind of, you have to pick and choose. And I think that's important to be your own researcher. Like if you read something, like do some proper research before you just start taking like 5,000 milligrams of vitamin C. So yeah, I think that's important. Obviously I have a couple things. We are allowed to go outside as of right now. I always encourage, I personally ride bikes and trail run, so that is what I've been doing. But even just, there's a lot of free, I think even on Instagram and other platforms, a lot of free yoga, movement, workout, things like that. And I think that's important. Helps with your mental health and helps your brain better cope with stress. So those are options. I said I wasn't gonna talk about supplements, but I think one to speak about in terms of anxiety and stuff is magnesium. Magnesium is a mighty micronutrient that helps calm the nervous system and can help lower blood pressure and relax smooth muscles. So, Oriana carries it there too. So, I think magnesium is important, especially if you're having a difficult time sleeping. Recommendation is usually 200 to 400 milligrams of magnesium. So, ask your healthcare provider or any supplement stores to help you with that. Speaking of sleeping, cutting out alcohol is probably important at this time. Everything in moderation, but usually that's a social thing, and I think now is the time to kind of see if you can eliminate that if you try. It's kind of a maladaptive coping mechanism if you rely on it to deal with stressors. So another thing to think about is eliminating refined sugars from your diet. The American Heart Association recommends less than 28 grams for women and less than 35 for men, I believe. So even just like reading your packages and labels and making sure that you're not getting that excess sugar. Because you want to have the healthiest immune system possible, and spiking your blood sugar can actually trigger more anxiety and suppress your immune system. And actually just like making snacks that are, I know you talked to Carol about snacks. I actually don't know what you talked to her about, but having a snack or having foods that are not spiking your blood sugar and maintaining a nice steady blood sugar level will help with that. I know you probably talked about meditation practices with some people already. I personally, I'm gonna go personally. I like to smudge. I don't know if you've talked to anybody about that, but just like kind of setting a calm environment and like either praying or asking, those kinds of things. I think that's really important at this time. Staying connected, obviously. We actually have my first virtual dinner party with Logan Call of Planted Cuisine, and it was fun, and it would brought in people that I don't think I would have met. Maybe it would have out in the real world, but it was a really neat perspective, and I really respected everyone that was there and what they had to say, and just hearing how they want to help. So it was actually really cool too. Bubby's Bagels donated 3 dozen bagels to that were left over, and I brought them into the hospital and distributed them amongst the nurses, and yeah, it was really nice. So we really thank you for that. And like I said, I talked to you earlier, stress levels are high with everybody, but especially being in the hospital in the front lines, it's stressful. And so what I did on my unit, and I encourage other nurses, if you're listening, to try and, if you recognize someone that's having a hard day or stressed out, I will give peppermint neck oil massages, and I like made a nice calming room in our break room just so people can take a breather and, you know, press the restart button. So what else? What else can we do?
That is fantastic. Because I think a lot of people also, I mean, nurses and doctors, healthcare professionals, of course, are front lines. But my coworkers at Oriana, they have been on the front lines this whole time. And so just trying to remember, you know, like we're all in this together and we all need to, you know, take little breaks. And if we're starting to get tense, maybe that's the time to reach out and give them a moment, you know, or give them some peppermint oil because we have plenty of that. So yes, absolutely.
Yeah, it's unfortunate that it's such a high level of stress. So I think it's really important to manage that and getting proper sleep too. Huge, having better sleeping patterns. I don't know if we talked about this, but you know, taking the TV out of your room, putting the electronics away before bed, and having a nice bedtime routine, even for the kids. I know I don't have kids personally, but I know that some parents have like an iPad of when the sun comes up, they're allowed to get out of the room, like leave the room. So I don't know, guru of kids yet, but I think that's important too, is having boundaries with your kids, and it's a whole new process of having to deal with this and adapting to a whole new lifestyle. So yeah, I'd like to make lists too. I don't know if that's helpful for anyone. It's just, you know, it's hard when you're anxious and you're overthinking, you know, you have all these things you need to do and then you just worry about them. But if you make a list and then you slowly start checking things off that list, it's going to feel a lot better. So,
Yeah, absolutely. I think that sometimes like that, just writing it down, even writing down your worries, giving yourself 5 minutes to write them down, worry about them. That way you give it that moment and that attention, and then you can move on with your day, you know, because because if you just keep kind of trying to avoid it, it's going to keep coming back.
For sure. Another thing I really encourage, especially and for people that are, you know, on the front lines is journaling. I mean, I've been personally journaling. I'm Canadian actually, and all my family's in Canada. They shut down the borders. I'm like, I can't talk. You know, obviously we can talk via virtual visits, and which is everyone else is doing anyway. But having a journal and like looking back, this is history. I mean, this is some strange time. So I always encourage that.
Yeah, no, exactly. I've been thinking about that too. I was on a run the other day and I was like, wow, this is building some serious resilience in a lot of us. You know, like we're all just like, we're going to be able to say like we survived this, and you know, like this is
resilience is exactly what it is, and it's grit, it's courage, and it's good. It's problem solving. It's so amazing to see how some small businesses, you know, are the way that they're problem solving to you know, have income and stuff, and we want to support that. You know, I'm going to continue working because I have to, but definitely we'll be supporting local, you know, local farms and local, and that's another thing I try and encourage is, you know, supporting locally. That's kind of what brings it down.
absolutely, yes. Yeah, we definitely still have local greens and, you know, local root veggies and things like that at Oriana, local cabbages. Yeah, I was in there yesterday because I've been working from home, and I'm so impressed with our team. I mean, it was stocked and like, yeah, I'm really proud of being a co-opper. Like, it's really amazing to see everyone come together and work really hard.
Great precautions by protecting the elders with their store hours and hygiene, and just I think we got this. I think, you know, Traverse City as a whole, I think everyone is abiding by, you know, the recommendations, which is important, and not going out if you're sick, washing your hands. Like you hear those things on the news every day, and I've had to like take a step back away from the news and set some boundaries for that. So I have like a dedicated like 10 minutes max, 5 in the morning, 5 at night, of my trusted news sources that I tune into, and then I'm good, because it does help ease anxiety just to stay informed. But yeah, definitely set some boundaries on that.
Yep, I've had to do the same. I like have my few resources I go to, and I keep updated for work. But you know, when I'm not, I try to disconnect a little bit just to keep sane. Awesome.
Exactly.
Well, do you have anything else you'd like to share with our community or our viewers today? Any other tips you're abiding by, or anything, any teas that you're sipping on or anything like that?
I have bear actually that I've been sipping on. Like the stinging nettle tea is pretty good, especially for allergies. They're going to be coming around. Stinging nettle is great for that. So kudos to Sierra making us our community healthy teas to sip on. We appreciate that. I mean, like I said, I think just doing your own research, trusting your own sources, and staying healthy. I think is the biggest thing you can do for you, your family, and your community. Stay healthy and support your immune system and get outside. I mean, it's stuff we always do anyway, but just keep doing it and stay positive. Just take some deep breaths. This hopefully will be over sooner than later.
Exactly. Yeah. And I think too, people, I hope that people are being easy on themselves, because this is something that a lot of us have never experienced. So like, if you have those moments of like, just like, oh my God, like that, I've been going through waves of that too. But when we talk to each other, we do our really healthy coping, meditation, yoga, breathing, just taking a deep breath, eating well. We can control so much. So just focusing on what we can actually control is huge.
Exactly. That's exactly what it is. Yeah, and self-care is something that you can control. And like in storytelling, even telling your story. And that's the thing, is like realizing that this is a subjective experience for everyone, and everyone has their own stories and their own, and you're like, whoa, like there's no woe is me. It's like, woe is everyone. Everyone is affected by this. So it's kind of good to know, like, the world doesn't revolve around you, and that you have to invest your time in yourself and your community. And yeah, I think that's important.
Absolutely. It's exactly it. As soon as I start to think about it, and I'm like, wow, because with anxiety too, it gets so personal. And you're like, I'm the only one experiencing this. It's like, no, 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 no. We're all here experiencing this together right now.
What's important to note about that is that if you don't take care of your stressors and your anxieties now, you can deplete a lot of important chemicals in your brain. And like as a provider who prescribes antidepressants, anxiolytics, and those types of things, there is a time and place for that. If you deplete those things, if you deplete those happy hormone chemicals, so it's important to manage stress. Still do the things that you enjoy. I mean, I may not be going out to get coffee with a friend, but that will come again one day soon, and just know that. So,
Exactly.
yeah.
Exactly. Yeah, exactly. I know, I'm like video calling everyone. And also something to mention too is that therapists, counselors are still able to see people right now, just virtually.
Yeah.
So that's a really amazing opportunity to talk to someone, to be heard, and have a third party just kind of validate how you're feeling and give you some healthy coping mechanisms too. So that's another opportunity.
And it may be a difficult time right now. Like I said, I work in a direct primary care office earlier, and we do accept new patients, and we do a lot of virtual visits. But navigating the healthcare system right now is probably challenging, not only for patients but also for providers. So virtual visits have been proven so far to be really helpful in alleviating a lot of anxiety. So always that option, and always talk to your primary care providers before taking any supplements at this time, just because they can have some interactions with other medications that you may be on. So.
Absolutely. Yes. Very true. Well, Megan, thank you so much for your time. We really appreciate it. And maybe we'll be able to check back in with you soon, but hopefully we'll be able to see you soon.
Good.
Awesome. Take care.
Thank you.